Friends. So today we will talk about review articles. So what is a review article? Uh, for busy clinicians, especially, I think this is the best possible way where you can get onto the publication ladder, where you are able to publish articles which is peer reviewed. Now, when you look at the hierarchy of evidence, with regards to research, systematic review is right at the top. I will do a separate video on the hierarchy, uh, but systematic review with meta-analysis is right at the top. However, if that is something which you don't have time to do, or you need the support of the statistician to do a meta-analysis, for example, which is not feasible and which cannot be facilitated, then just doing a descriptive review article in itself is a very strong evidence-based work. Uh, so usually what you do is you have a question in your mind, maybe a clinical question or an academic question or anything to do with medical education. If you've got a question in mind, now you need to find an answer to that. And there is a possibility where it is available, it is there, which you need to search and then gather and then analyze and then describe it. So, say for example, you saw a particular case in your clinic, and it's a very difficult, a very complex case, and you want to start a particular treatment which is not licensed. But you know that this particular medicine will work. So why is it that this medicine is not evidence based? So then you do the search, whether has there been any studies done in the past related to this off license use of this particular medication, and then you try to compile all that search and then try to arrive at a conclusion whether this medicine should potentially be included in the guidelines or not for treatment of a particular disease, for example. So that's why your review articles are very useful. I've also noticed that sometimes loads of studies are done worldwide, and it is very difficult to keep a track of every study done all over the world. And so maybe even if you're doing a particular clinical trial, maybe this particular study was done elsewhere. So rather than duplicating your work, a review article is a best possible way where you can compile all these studies which were done in the past, and then you can arrive at a particular conclusion without even doing a study. So that is where these review articles or systematic reviews are right at the top, because you are trying to compile the studies already done. Obviously, these studies which you are including in your work has to be peer reviewed, for example, or it has to be of a good sample size. So the studies which you are including has to be quite a strong study. It is when it comes to time, it is less time consuming compared to doing a clinical trial. So say if you're doing a clinical trial, you have to first go through the ethics or even funding, which in itself, if you combine the two, will easily take you a year or even more. Then you do a study which will take maybe another year or a couple of years, and then you start doing the analysis, and then you start working on the manuscript. So it's easily a minimum 3-year journey. Whereas when it comes to review article, you work on it, say maybe for 5 to 6 months, and then you submit for publication. That may take another 6 months. So within a year, you have got a very strong article published. So that is where I think review article is very useful. Now, how to draft a review article? How to design it? So usually what I do is the review articles which I've done, I've divided that into 3 paragraphs. You start with an introduction, then you do a body, and then the conclusion. So in introduction, obviously you need to describe about the background of that particular. So say for example, let's take a random example of you want to test an antidepressant for a particular condition, for example, where especially in treatment-resistant depression, for example, you want to identify a particular medicine. You have identified and you feel that, and this has been used as an off license. You've tried all the recommended antidepressants and it is not working, and you're focusing on this. So the background of your introduction would be that you're talking about depression and the treatment used currently. Now, why is it that you are talking about this medicine? And then you can describe that in some cases, especially treatment-resistant cases, sometimes we have to then either consider ECT, but this medicine has never been considered, never been tried, or never been. It has been tried in the past, but it is not included in the guidelines. So you would want to explore that is there a possibility where this could potentially be included in the guidelines, and then eventually it can be prescribed by the doctors. So your background is about depression and the currently used treatment, and then why you want to include this particular medicine in the current recommendations, and where are the gaps. So again, it's about, you want to know that by the current treatment regime, the recommended treatment regime is not working, and where are the potential gaps and why this particular medicine can potentially fill that gap. And that is how, how do you think that this particular medicine can potentially fill that gap? And that is the aim of this particular review. Then you do, then comes the body of the article, where you do the detailed description of this particular medicine. What is the psychopharmacology? What, and how does it relate to the pathophysiology of the particular condition you're focusing on? So that is all described in detail. And then you start, searching the articles. So when you're doing a review article, you have to ensure that you're including both the pros and cons of the medication. So so maybe you have that preconceived notion that this medicine may work or it works. But when you're doing a review article, you have to critically review every articles you are reading, whether it is for or against the use of that particular medicine. And then based on the data you have collected, based on the articles you have read, then you give your interpretation that overall, this is what I think, that, there is a possibility where you can include this. It is always important that when you're doing a review article, that you include the limitations. It could be many things that, you have included literature, reviews, or you've included article or studies with a smaller sample size because you couldn't get any studies with a larger sample size. So, or, maybe some trials were not randomized double-blind control trials, some were open label studies. So you can include that in the limitations, and you can also include that although you're arriving at a particular conclusion that, this medicine is potentially suitable in this condition, however, further studies are required to establish the potential use of this. So again, it's always important to give that, to be totally unbiased and give a very critical review of the work, of the articles you have selected, you have included, and then you are summarizing it, totally unbiased, in a very unbiased way. And then you also, so again, if further studies are required, so that is your future direction. And then when you do the conclusion, you summarize what you have, what is your final outcome of this article, and then what is the future direction, then what needs to be done, whether you've got enough evidence where it can potentially be included in any guidelines which is being followed, or further studies are required. So maybe, sometimes, we've noticed that you have that preconceived idea that this medicine will work, but then when you start reading upon it, you end up arriving at a conclusion that, no, I was wrong. This medicine is ineffective, for example. So that's fine. At least you've done that piece of work, you had that in mind, but then you are arriving at a conclusion that no, most of the evidence suggests that this particular medicine should not be recommended because of, maybe because of the side effects, because of the limited evidence available, or whatever. So again, a review article is something which can which is so useful in a way that it can also change your concepts in a way, because you've read about it in depth. So not only you have enhanced your knowledge base, but that knowledge you've gained has helped you change your practice, maybe for good, and that can eventually help in your daily practice. And also this future direction helps you. Maybe this particular review article can be used as an evidence when you're when you're drafting a research proposal, or when you're applying for funding application. You can say that I've already done a robust literature search and a literature review which has already been published, so that then you have a very strong case to apply for funding, and your position is very strong then, because you've done a very extensive research on this already, that what were the potential gaps identified. So you've already done that groundwork, which will help you in securing the funds and even the ethics required to do the clinical trial on that particular medicine or whatever. So I hope this was useful. I think most likely my next video would be on the hierarchy of research methodologies. So watch out for that space. All right. Thank you very much. Take care. Bye-bye.